Hey guys, it's Jessie with Omaha Mom Talks, and I have some exciting news. I am partnering with Edwards Auto Group, a local car dealership with locations in Nebraska and Iowa, for a fun partnership called Mom versus Machine. Every couple of weeks, I'm going to be test driving a new family vehicle and giving it the full mom review. We're taking it out of the showroom and into the hands of me and my family of four. We're going to be seeing if it can handle car seats, snacks, strollers, backpacks, how easy it is to clean, how much room do we have, and I'll be giving you my honest thoughts. If you have a car that you have been eyeing, let me know. If you have any must-have amenities when looking for a car, share them with me and I'll be sure to give those a closer look. Follow along and see which car can actually keep up with our family chaos. Welcome back to Omaha Mom Talks. I'm your host, Jessie Gutierrez. I am a mental health therapist that specializes in maternal mental health, and today we are going to be talking about something deeply meaningful, and that is birth trauma and the NICU experience. I personally have seen how powerful it can be when we bring these stories out into the open. I know that the emotions are so deeply layered, the confusion, the grief, and often there's a lingering sense that something didn't quite heal. Today's guest is Kanjana Hartshorne. She's a mental health therapist. She is also certified in yoga therapy and is a Reiki master at Healing Hearts Wellness. I do want to give a bit of a heads up and trigger warning that our guest is going to be sharing about her own traumatic birth experience and NICU experience. So if that doesn't feel like something that you are ready or prepared to listen to, go ahead and hit pause. For those that want to hear about her story, please know that we also are going to include some tangible steps that can provide healing and hope for those that can relate. Let's get into it. All right, Kanjana, welcome to Omaha Mom Talks.
Thank you so much for having me.
Yeah, we're excited to have you and share all of your wisdom with our listeners. So, before we jump into that, can you just share with us a little bit about yourself?
So I am a mom, of course. I'm a licensed clinical social worker. I'm a certified yoga therapist and a Reiki master. And
Awesome.
I have two businesses I'm happy to chat about. One is a small group practice focusing on somatic therapy and holistic therapies. And the other is kind of like a therapy training community or home for
Okay.
therapists.
Awesome. Very awesome. And then you also provide, yeah, like trainings. Is it nationwide
Yes.
for
Yeah.
therapy?
And, knock on wood, hopefully soon internationally.
Okay, cool.
Yeah. And my specialty is trauma, chronic illness, medical trauma, and bringing the nervous system and nervous system work into session.
Okay, wonderful. And we have never met in person, but I had put out a call into a local mom therapist group of women who are all therapists in private practice, looking specifically for some specialties, yours being, the NICU experience and birth trauma. And then you also shared something cool with me because well, tell us, I guess, where you currently live and then that Omaha connection.
Yes. So right now I live in the Philly suburbs, but I actually did live in Omaha for a year. My family moved there when I was a senior in high school. So I moved into Millard North, which
So
maybe
cool.
sounds familiar.
Yeah.
So I went there for a year and then went off to college while my family stayed in the Nebraska area. And they were there for, gosh, a while until my younger brother was ready to move on to high school. So I guess they were there for at least a decade.
Okay, very cool. Well, when you said that, and along with all of the, somatic healing work that you do, I was like, I feel like it was meant for us to meet. So,
Yes. Yeah. Like what a random connection to have in common. I
really,
don't meet a lot of people who've been to Omaha or are
hi.
from there.
Yeah, I love it. So, how old is do you have one child? Is that what you
I have
said?
one child.
One.
She is three.
She's three. Okay, very
Mhm.
exciting. And tell us a little bit about what drew you into these holistic somatic healing modalities.
Yeah. So I actually was into them before becoming a therapist. So it was more about like, how did I unlearn some of what I learned as a therapist and start
Yeah,
bringing in some of my personal passions. Uh, they're cultural and ancestral practices that are based in thousands of years of evidence, but we're often in Western contexts discouraged from using these
mhm,
practices in session. So I kind of started with those practices and then
right,
became a social worker and was like, why are these two separate things?
right.
Let's blend them together.
Yeah, that makes sense. So it was natural for you
Mhm.
instead of some of us who have like an awakening. And
Which is awesome too. I think I just had mine, at a different stage.
yeah, yeah. Well, we are going to be talking a little bit about birth trauma and the NICU experience. And so
Mhm.
let's kind of dig into that topic. I think that we often talk about pregnancy for a lot of people, and especially, in social media and traditional media in these like storybook book terms. And for some moms, that is their experience. And for others, they may leave the hospital feeling disconnected, shaken up, and rattled. And so
Mhm.
let's just kind of first talk about how do you define birth trauma in a way that listeners might recognize?
Yeah. So the way I define it is that it's not about the delivery method or even about like what your outcome is medically.
Yeah.
It's more about your perceived loss of safety or
Hmm.
loss of control or even threat to life, whether that's you or your child. Uh, it's really what research shows is that it's kind of a subjective experience. So
Yeah.
it's not like what was in your medical chart is going
Right.
to predict that, like, maybe you're going to have some trauma after having birth. It's more about what happens inside of your nervous system when something is overwhelming your capacity to cope. Like it's beyond your window of what you can tolerate.
Yes. And yeah, and just in trauma education in general, always share with my patients, similar to what you said, is it's not about the event or what happened, but it's about the experience and the emotional experience for that individual. Because you and I could both have the same, what somebody might say, traumatic experience, but I could walk away totally shattered and broken with PTSD symptoms, and you could walk away like, man, that was really hard, but I'm feeling okay. And
Yeah.
so it really is such an individualized, subjective experience when we're talking about trauma. And I think that's so important
Yeah.
because some people like to um, minimize
Hmm.
pain and experiences that may not seem like trauma to them or not what they've heard about as trauma.
Yeah.
So I think that is
Yeah.
an important distinction. And then with the NICU experience, um, when you think of the NICU experience and trauma, what comes up for you in your mind?
I mean, it's a very unique experience, but it's high sensory, right? So, of course, there's the things that you're gonna expect, like being separated from your baby. That really stinks. A lot of sound and alarms and lights and no privacy.
Hmm.
Sometimes, like, you have to ask if you can hold your own baby. There's a lot of medical lingo and jargon. Getting discharged without your baby, that can be really
Hmm.
rough. And
Hmm.
then I know we'll talk a little bit more about it, but a lot of moms experience guilt or hypervigilance around their body or feeling like it's their fault in some way. And just like you said, why is there some one person walking away with PTSD and one without?
Right.
Did I not do enough? And then fears around, like, have I messed up my child? What is our bonding going to be like? Are we in trouble in terms of attachment? And I hear that from a lot of therapist birthing parents too, that like, hey, I know all this attachment stuff and now my baby's
Yeah.
in the NICU and I'm panicked.
Yeah. Yeah. Sometimes knowing more can cause you more stress. So, if you feel comfortable, I would love to hear just about your lived experience and sharing about your pregnancy, your birth, and your NICU experience.
Yeah, I'm very happy to kind of give you the my story and share that with you because I think it's so important to normalize these experiences because when it happened to me, I it was such a shock and uh, it was so far from what I had expected, and there was a lot of questioning. So for
Mhm.
me, it started out with a really healthy pregnancy. I was actually losing weight in the first couple trimesters, and we were keeping an eye on that. And then suddenly, partway through my third trimester, I rapidly gained 20 pounds in 3 days. and of course called the OB, and they said, well, you're just a big girl, so we're not worried about it, and sent me home.
Okay.
And then my baby stopped kicking. So fast forward, we ended up in the hospital with severe preeclampsia.
Okay. At how many weeks?
28.
Okay.
She ended up coming out at 32. So at before 30, I got the steroid shot, which helps them develop their lungs. I did the magnesium drip, which can be kind of disorienting, and you feel like, a lot of people say, a fishbowl.
Okay.
And then I had an emergency C-section. We were hoping she would stay in a little bit longer, but she was ready to be here. So she came out 2 months early and went right to the NICU. I did not get to see her or hold her. I saw her little foot pass by as she was rolled away, and I didn't see her until the next day. And I was there for a few days, and then I got discharged, and she was there for 30 days.
Okay. You got discharged and then she was there for 30 days. And did you have support through that process? I'm just thinking from the early stages of, I think you said the 28 weeks of
Hmm.
going in.
Yeah.
What did your support look like from getting that news so early on?
Yeah, it was definitely mixed. I didn't feel very supported by my medical team. I kind of felt gaslit that, hey, I have some strange symptoms and this weight gain and a lot of wild swelling that was not normal.
Mm-hmm.
And unfortunately, out of support, the loved ones in my life who had been pregnant previously said, that swelling's normal. I dealt with a lot of swelling too. And so
Mm-hmm.
that kind of reinforced it for me. And I second guessed my gut feeling of, no, something still feels wrong.
Mm-hmm.
But my partner, my husband, was very supportive and like, okay, if something's wrong, if you're going to be worried about it, let's just go.
Mm-hmm.
I'd rather go to the hospital and be sent home than
Yes.
not go. So that was
Yes.
really lovely to have somebody on my team who was saying, like, yeah, let's just, if you want to do it, let's do it. We don't need the yes from the doctor.
Yeah, and I hear that so often of women not wanting to be a nuisance or not wanting to
Mhm.
seem dramatic or a variety of similar themes of like not wanting to take up space or bother people. And when it comes to your advice to women and their medical health, what do you share with them as far as guidance and listening to their bodies?
Yeah, absolutely take up space, right? It's okay to ask these questions. That's part of whether or not they're responding to you in a way that is kind and expected.
Hmm.
Uh, it is part of their role to answer your questions, and you have a right to ask them and to have comfort in your care and to consent to it and to have understanding before making decisions. And if you find that you're a people pleaser or you have a trauma history or whatever is getting in the way of you advocating for yourself, because sometimes we get put in these tough situations, have someone there who can support you, whether it's your partner or a family member or a doula. Just having someone who can share that load can be really
Yes.
helpful.
Yes, absolutely. So when you went in, did they keep you?
Um, well,
They
they
stayed
couldn't find
home?
my baby's heart rate, so they kept me until they could find it, and then
Okay.
I was in and out for a couple weeks.
Okay. And so then you go in, and at what point did they decide an emergency C-section was warranted?
So at we did the steroid shot right before 30 weeks, and they said just try your best to make it to 30. And so I was in the middle of severe preeclampsia, but they said, like, your baby will do better if you wait longer. So I said nothing. And by the time the doctor came back, maybe 3 or 4 days later, I couldn't speak. I was in so much pain. I was just weeping. I had run it by the nurse, and she said, like, it's like, don't be a baby kind of thing. So I was
Oh,
like,
no.
okay, I'm being a baby, so I'm just not going to say anything. And then when he came, he was like, you should have called 2 days
Oh,
ago.
no.
We don't have a choice anymore. Baby's coming now. Like, you don't get to have a say. It's like, oh, I didn't know I had one if I had called you 2 days earlier. So it
Right.
was kind of wild. I don't want to scare anyone. My experience in this piece was not the norm.
Yeah. Yeah. And so then I guess just in that piece, if there are people from the medical community that are listening, in what ways can they better support pregnant moms that are experiencing similar?
Yeah. I mean, I think there were a lot of intersectional identities that I hold that made it extra challenging for me to get care at this stage of my pregnancy. And so I think for healthcare providers, just being aware of that, that your like birthing parents or women of color are coming in already nervous
Mhm,
about whether or not we're going to be able to get care. When we communicate that we're uncomfortable, will it be seen as hysterical or flat? So maybe you're not actually in pain. So even the way you present your pain might be something you're thinking through. So for
mhm,
providers, it's, knowing all that emotional labor that goes into simply asking, hey, I'm having this weird symptom.
mhm, mhm. And what are some things that moms, now that you're on the other side of it and you're stronger in the like you're clearer in your thinking when you're on the other side of it. When you're in it and you're scared and your logic and reasoning can't be accessed, it's so
Yeah.
hard. But in what ways can moms advocate for themselves and what ways can their support people advocate for them? Any advice or
Yeah.
tips there?
Yeah. I think that, trusting their own experience despite what others are telling them. If others continue to tell you that, like, no, your experience is just in your head or mom brain or whatever they say to you, and you
Mhm,
still feel like something is off, continue moving forward. Maybe that means you have to pursue a different provider. Maybe that means your support system jumps in and helps you. I did find, this is the thing that I hear from other women too, that sometimes if you have a male partner and they're the one to jump in and say something, you might get a little more movement. And it
mm,
stinks, but
mhm,
that is something I see again and again working with moms with birth trauma and hearing their stories.
mhm. What are some things about the emotional experience of birth trauma and being a NICU mom took you by surprise?
Yeah, great question. I think for me, what really surprised me emotionally was, I was a trauma therapist for a really long time.
Uh-huh.
And here I am being like, now I'm a birth trauma patient.
Mhm,
And I didn't expect something that I thought was going to be so joyful to be so intense. So there
mhm,
was a lot of shock, some dissociation, which was kind of surprising for me as someone who tends to be very present,
mhm.
uh, and then just reacting in a way that didn't feel quote unquote normal for me, as if I had been through this
Yeah.
many previous
Mhm.
times. Like, it's an abnormal situation. Of course, I'm having a quote unquote abnormal reaction.
Right.
And then this mix of relief and grief and like guilt and joy, these holding of what felt like opposite emotions,
Uh-huh.
and just things that lingered longer than expected, that I kind of wish someone had given me like a little bit of a heads up.
Mhm, mhm. Yeah, I think that lingering is important. Did you feel any pressure to move on, quote unquote, quickly? Whether that
Yeah.
be like implicit or explicit messages directed
Yes,
to you?
both. Yeah,
Mhm.
and even internal implicit messages, right? That we might not catch until something like this happens. And it's like, oh, I do talk to myself that way too. It's not just externally, where it's this pressure to like move on. You have your baby right here. Be
Yeah.
grateful. Here she is. You're so lucky. Like, at least your baby's healthy. It's almost like we take gratitude and weaponize it to silence grief, but
Yeah.
gratitude and trauma, gratitude and grief, these things can coexist.
Mhm. And I hear that so often from women who oftentimes I'll meet, women in their postpartum period for symptoms of depression or anxiety or what they're coming to me for is depression or anxiety, and then
Mhm.
when we touch on either their pregnancy or their birth experience, they're like, wow, it's like reopening it but not knowing, like, I had been experiencing so much hurt and grief and pain from that thing that I experienced. And so many women will say to me, Jesse, do you think that what I went through is trauma? And it's almost like they need or want someone else, outside of them to say, um, your pain is enough.
Yeah.
And oh, it always like breaks my heart because
Mhm.
I'm like, yeah, like you went through something Absolutely so scary. Your life was threatened. Babies, this most precious being was threatened. Like, absolutely. And sometimes just hearing that is such relief, almost like, okay, I didn't make that all up, or that was really scary. And here's
Yeah.
because everyone else in their life is often wanting, just like you said, wanting, oh, your baby's here, it's healthy, like their entrance to the world is hard, but like let's think of the future. And those are good intentioned people that want mom to feel relief quickly.
Mhm.
But we know that that pain deserves attention.
Yeah, exactly. And one doesn't have to negate the other, that we
Mhm.
can have space for the pain and still celebrate all the joy that's here for us now. And if we ignore the pain and don't make space for it, it is going to be harder to tap into
Mhm.
that joy.
Mhm. What things I heard you say, like lingering, and I love that word
Yeah.
because to me that's just stuff that deserves our attention, right? That still
Mhm.
needs healing, and we can provide that attention and give it that healing. What things for you after a discharge from the hospital felt like they were still lingering?
Yeah, I mean, definitely hypervigilance, right? Just always being on edge. Discharge doesn't mean like, oh, suddenly my body and nervous system feel safe. Like, we're home, yay, we're safe. So that hypervigilance, uh, sleep disruption, like, of course, you already have that as a new mom, but
Yeah.
even with baby being in the NICU and being at home, uh, sleep continued to be disrupted. Never feeling like I arrived home. Like there was this expectation of like, oh, coming home with baby, and it's like a relief, and the new chapter is starting, and just
Hmm.
never having that moment. And of course, just distrust of the medical system and feeling kind of like the system betrayed me. I didn't feel betrayed by my body, but I hear that a lot with the parents I
Okay.
work with. And
Hmm.
I kind of felt betrayed by my yoga practice because I said, I did all the
Hmm.
things for so long to keep me and baby safe. Like, how rude of you to not keep us safe.
Yeah. We were counting on you.
Yeah. Hmm. So,
With go ahead.
oh, yeah, the one other piece that surprised me is postpartum rage. That was not something anyone had warned me about.
Uh-huh. Yeah. How quickly did that onset happen for you? Do you recall?
Um, the shock lasted for me for a long time, but once she was home, so after a month of being in the NICU, and we were kind of in our own bubble for a few months, and then after that, when we started expanding to allow other people into the bubble,
Mhm.
that's when that rage started showing up for me.
Mhm.
Uh, and there's a lot of shame, that can show up with rage too.
For sure. We actually have an episode coming out on mom rage, like right before our this episode airs, and so I
I'm sure it'll be
want
amazing.
want to normalize that for moms. I want to back up just a little bit, and if you could share with us a little bit about that experience of being discharged yourself and baby still staying within the NICU.
Yeah.
Maybe for those that are listening that can resonate, or those who like have no idea what that experience is like. Can you share with us a little bit about that for you?
Yeah. It was really, really hard for me. I wish they had just had a room that I could stay in and could just like, or actually that we could just both be in the same room and just the two of us,
Yeah.
if we could wave a magic wand.
Yeah.
Uh, I will say that I did not have the healthiest experience in terms of some of the choices I made for myself with being separated from my baby and going back and forth to the NICU. This doesn't happen for everyone, but for a lot of women, when we have a big hormonal event like a birth or
Mhm.
I went through IVF treatment as well, so a lot of hormones involved there, or even postpartum or perimenopause. Sometimes neurodivergent symptoms can seem to increase.
Okay.
So that is something that showed up for me where I didn't have a name for it yet, but
Okay.
later discovered after a couple years that, oh, okay, I'm neurodiverse. And that's maybe what happened. So that was a little bit of what had happened to me in that discharge period and being away from her was
What were some of those symptoms for you?
yeah, hyperfixation,
Okay.
which is something I've struggled with my whole life. And I'm glad I finally have the language for it. But I hyperfixated on attachment and being with her, the exact thing I'm speaking about today and
Yeah,
recommending that mamas don't do,
sure.
because I took it too far, right?
Okay.
And that,
So were you saying like the frequency of like how often you were there was maybe extreme? Would you
yes,
use that language?
yes, it was extreme. I had nurses pull me aside more than once to tell me I need to eat and drink and use the restroom and go on walks.
Okay.
So I was definitely in it and feeling the anxiety and the trauma and the hypervigilance, but unaware that that was happening because of the level of shock.
Mm-hmm.
Uh, so I wasn't in a place where I could receive that talk and say like, "Oh
Mm-hmm.
yeah, you're right. Like let me go home and sleep." It was just like,
Mm-hmm.
"Why are you wasting my time with my
Yeah.
baby to give me this talk?"
Yeah. Yeah. What was your partner's reaction to that? Or did he have any feelings about, yeah, you should come home or let's go get you some food?
Yeah, he definitely made sure I was eating on the way in and the way out, but I think he knew that it was going to be a tough
Hmm. He knows
thing to
you.
try to, yeah, convince me to do it another way. I was just so, zoned in on
Mhm.
how I thought it was supposed to go. And I
Mhm.
did, have a lovely time with her at the NICU and felt very close to her and did a lot of things that helped me feel really bonded to her that were important to me.
Yeah. Can
But
you share with us maybe ideas for other moms who,
yeah, yeah.
um,
And just the one piece is like calibrate, right? So I did a little bit on the extreme end, but we don't have to, it's a spectrum, right? We don't have
mhm,
to be over on the left or the right. We can shift depending on our needs that day. So instead of doing everything every day, you just dip a toe in, right?
mhm.
And do it when it's available to you. But yeah, I'm happy to share some of what helped me. Um,
Especially as it relates to that bonding, because that
yeah,
is something that I hear as well. And so, if your baby is in the NICU, what are some ideas either that you've done personally or you've helped other moms with in bonding with baby while they are in?
yeah. So one of the things I really love about the NICU is they are so good about this. At least the one where I was, and in my area, we have a couple trauma centers and NICUs that do a really lovely job of educating parents. So they should provide some of the information like skin to skin and
Mhm.
whether sometimes you can't breastfeed depending on baby's ability and medical needs, uh, but even just having your baby on your body can help with production so that skin to skin contact that they will definitely talk about and encourage, and they
Yeah.
teach you how to do all the things. So, my baby's first bath, she had been in the NICU for a few days and they waited till we were there and then walked us through how to give her a bath with her tubes and wires and the
Yes.
bucket, and it felt like a primer, like a little class,
Yeah. Yeah.
a private one-on-one, which is, a nice benefit of being there because as a
Mhm.
first-time mom, I felt like I already didn't know what I was doing. My baby came before I had a chance to take the classes I had signed up for at the hospital.
Right.
So
Right.
it's like, oh no, what do I do? And they had some
I
built
take care
in.
of this baby.
Yeah. And so then my role as a therapist is great. What can we do to support mom too?
Mhm.
So, if you're not able to hold your baby, but you're sitting with them, you can do eye gazing if their eyes are open. You can place a hand on your heart and one on your belly or one on their like little container that they're inside of.
Mhm.
If they have that, or on the edge of the crib, and just notice your breathing. And I encourage folks to just try and let your exhale be one moment longer. You don't have to count. It doesn't have to be so long that you're gasping for breath. That's probably too far anyway. So just letting that exhale be one moment longer. And I just let them know that, research shows that lowers our heart rate, which is one way to tell the body that, hey, this really stinks. My baby's in the NICU, but physically we're both safe. So let
Yeah.
me lower my heart rate with that extended, slightly longer exhale. And then just that pressure of your hand on your heart or your abdomen. Like, hey, I'm here. We're not
Mhm.
alone. We're
Mhm.
together.
Yeah, and even just talking with your baby, is
Yes.
so
Mm-hmm.
beneficial. They know your voice already. They've listened to
Yeah,
you. And so
exactly.
narrate.
Reading books that you have, like if you've already, some people get gifts that are books, right? So like I brought several of those in with me and had a couple favorites that I would read to her that, you get in the same rhythm, and there's something about it that's soothing not just for baby but for mom too.
Uh-huh.
There's a couple scripts I really love. So, there's a Harry Styles one that's on the Calm app, and I just typed it in
Nice.
and was like, let me find the script. And I just read that to her on repeat. It's like for sleep, and it was
Okay.
very soothing.
For
Uh,
both. Yeah.
yeah, rocking with baby, if baby's allowed to move, that can create co regulation, and that rhythm can feel really good, or swaying. Um, like you said, like talking to baby out loud, also saying what's happening out loud can be
Hmm.
helpful. So, my body, there was a loud noise, the garbage truck went by. My body thinks I'm back in the hospital.
Mm-hmm.
I'm home right now.
Mm-hmm.
I'm not in the hospital. It was just a loud sound. Makes sense that I would react. Right. So, we're speaking to ourselves with kindness, we're naming what's happening instead of like feeling ashamed that there was a loud sound and then my body panicked. No,
Right.
it makes sense. Last time there was a loud sound, my baby wasn't doing well. Of
Yeah.
course, I'm going to feel nervous about that.
Hmm. I like that a lot.
Yeah.
One of the things I was thinking about as you were mentioning, the separation from baby, you being discharged and baby being in NICU, you
Hmm.
know, the, you and the moms that are listening, like you are still physically healing
Hmm.
from birthing a baby, from
Yeah.
all of the weeks and months leading up to that of being pregnant, and so really emphasizing that nutrition, trying to get some sleep,
Mm.
even though I understand it's fragmented, but doing those basic wellness things that'll essentially help you heal faster,
Yeah.
right? But that's such a critical moment where we want to jump in. And I don't know how far were you from your hospital? Is it
20
local?
minutes.
Okay, so yeah, I mean, I think that's important too, just to mention of like you still physically need to heal and to rest.
Yes. Yeah. In order to care for your baby. And if you struggle with things like hyperfixation, then getting support around what do I do when I am really having a hard time transitioning out of and into the NICU. Because that was, a piece of it for me personally. It's not everyone's story, but that was one of the struggles, was transitioning in and out and just wanting to be there 24/7, and
Mm-hmm.
that not being an option.
Mm-hmm. Yeah. From a lot of the moms that I hear from, I hear a lot of the same themes of some of that numbness, feeling disconnected, a lot of
Mm.
helplessness,
Yeah.
anxiety for sure. And sometimes this is even like months, later. And so,
Mhm.
what are some of the, I guess, telltale signs that someone's nervous system is still experiencing trauma in a way that needs their attention?
Yeah. So if they're still having intrusive memories months after discharge, right? They're still seeing that birth or the NICU experience in their mind's eye.
Mhm.
If they feel anxious or panicked or on edge whenever they go to a medical appointment, so all those follow-ups, and with a child in the NICU, you have a lot of medical appointments to come,
Yeah,
and if you
yeah,
also have medical recovery needs, that's even more appointments. So if there's hypervigilance around that piece, or you're avoiding medical spaces, that can be a little bit of a red flag. um, if you continue to have challenges in sleep or finding
yeah.
rest, even when your baby is asleep or resting, um, that numbness continues on, or that rage shows up and it doesn't feel like you, like just
Mhm,
feels like something is very different,
mhm.
or you feel really disconnected from
Yeah,
yourself, from your body, from your baby. Uh, None of this means that you're dramatic or ungrateful or there's anything wrong with you. It
or
just,
bad mom, because I hear
yeah,
the disconnected from baby
yeah,
sometimes, and moms, there's so much shame in saying that out loud, and so I wanna
exactly.
name that that is a common thing that I see in my patients.
Yeah, I mean, you think about it, your body just went through something really, really intense and it's focused on survival.
Yeah.
Like, you're allowed to heal, you're allowed to focus on that.
hmm hmm So let's chat a little bit about some of like the actionable parts,
Yeah.
for that moms can take with them.
Hmm.
Share with us a little bit about somatic healing, like what
Yeah.
that means to you and why that may be powerful for birth trauma survivors and NICU trauma.
Yeah. Yeah. So for me, somatic healing is bringing in the body, right? It's more bottom up than top down. So what I mean by that is a lot of therapy is talk, right? We're all walking around from the neck up. We're all in
Mm-hmm.
our heads and maybe not noticing as much what's happening in our bodies. But when we go through something like this that is fully in the body as we experience it,
Yeah.
just talking about it often isn't enough to shift it, right? We can't just
Mm-hmm.
talk our way into felt safety again, into body trust again. So somatic work is working with the body to shift the body relationship rather than changing the way we or reframing the way we conceptualize it. So it's a
Mm-hmm.
lot less cognitive or thought based and more let's feel the shift in our bodies and notice if that shifts anything in our thinking.
Mm-hmm. Mm-hmm. And with the practice, like, are you doing that one-on-one in your therapy space with your patients, or what does that look like in your
Yes. Yeah. So it can really vary. For some folks, it's like a lot of psychoeducation and traditional talk therapy, and then we'll do a 2 minute little somatic practice, whether
Okay.
it's movement or I'll create a personalized meditation and record it for them to listen to at bedtime or during birth or at doctor's appointments. It could be nutrition, it could be philosophy, mindfulness,
Mhm.
lifestyle changes or skills to better support their individual nervous system needs. Or, like, that's one end of the spectrum. The other end is like the entire session is somatic, whether it's
Okay.
movement or breath or energy work. So it really depends on what my clients' needs are that day. Some
Mhm.
people I'm kind of oscillating between the two, and others tend to live in one camp where they prefer more intervention heavy or more talk heavy.
Mhm. And for somebody who might be totally new to hearing about somatic work and
Mhm.
feel like, oh, that's a little weird. What would you say to those folks to encourage them to keep an open mind, and then also maybe like some of the evidence that we know about how the body heals and holds pain?
Yeah. So it totally is a little weird, and that's okay. Most things in life are. Um, there's a lot of science behind the body in mental health. And I think that the way I most quickly explain it is even if you don't think your body is involved, like you could probably think of a time where you felt a little nervous or stressed, and when I just ask you what that feels like or how stress shows up for you, you might share some things about your mind, but you might also share some things about your body. That maybe your breath is faster, you feel tense in your shoulders or your jaw or your face or your
Mhm.
glutes, wherever you hold tension. Maybe you squeeze your hands. You might notice that, you can't get a full breath or your posture looks different, your voice is shaking, right? So
Yeah.
there are physical signs of that anxious thought or feeling, right? That
Mhm.
moment. And so when we talk about that, you have to give a talk, you're really sweaty and you're nervous and you have butterflies in your belly. That even if you don't speak for work, you probably had to at school, right?
Mhm.
So most people, we can find one lived example of a time where what they were experiencing cognitively was also felt within their body. And then that can feel like oh, well, that's just so hopeless. Like now I'm thinking in this way that's quote unquote negative, and now I feel that way, and it's just a cycle and never stop. And that's where I'll pause them and say it's actually a two-way street. So this is really an opportunity that yes, symptoms can show up in our body based on what's happening in our mind, but it goes both ways. So
Mm-hmm.
if we change what's happening in our body, we shift that tension, we shift that breath that shows up and reinforces the idea that we're in danger or we're stressed, then suddenly the mind can be open to more possibilities. If I'm not tensed so hard that says, where I'm like ready to run as fast as possible because there's a bear chasing me, of
Mm-hmm.
course my brain is going to present more anxious thoughts because my body is feeling so unsafe. But if I can settle my body, my mind can be open to, oh, okay, maybe my body is doing that pattern that it always does when it thinks I'm in danger.
Mm-hmm.
Physically, I'm safe. Emotionally, I'm kind of feeling vulnerable. That feels like a much different response
Yeah.
to that rather than a reaction. So
Mm-hmm.
that's kind of how I talk to people about, like, if it feels woo woo, you know, it, science, magic, it's the same thing. It's all
Yeah.
different language for the same thing.
Yeah.
So I'm very
I
happy
love
to give you the science version.
Yeah, I love my moms that I think of as like the type A, like intellectualizers that
Mhm.
we always have a giggle. Like they crack me up where like they're resisting me dropping down into the body. And when I'm, like, oh, we're doing that thing again. I'm gonna guide you back. And they're like, oh, why are you making me do this? But they giggle because they know like there's a reason behind it. And there's usually a reason why um, they're blocking that because it feels, super uncomfortable. Maybe there's
Mhm.
old messaging there of like why that feels too vulnerable or too unsafe.
Yeah.
But we always have like the best time figuring that out together. And I love it when they start like catching themselves of like when we are doing a somatic practice and then they drop into their thinking brain and they're like, ah, doing that thing again. And I'm like, yeah, you are. And you noticed it this time. You didn't need
Yes.
me to notice it. I love it.
Exactly. I love making that a celebration too. That, like, instead of like, oh, I'm doing that thing, like, yeah, if I scold my dog every time he goes potty in the house, like, he's just gonna hide and go potty under the couch. Like,
Mhm.
but if I say, oh my gosh, I caught it, my mind is actually now aware in the moment instead of like 3 hours later, that's really amazing. And I
Yes.
don't care if it feels cheesy, let's celebrate it. Like,
Yeah.
Pavlovian response is a thing. If we make it positive, it's so much more accessible to us going forward.
Yes. So, what is maybe like a mini somatic practice that moms can try, today, whether that be like in between feedings or diaper changes, something that feels supportive and somewhat easy?
Yeah, I think whether or not you're holding baby, finding a place where you have support against your bottom and against your back. So that could be sitting in a chair and just really like allowing it to hold the full weight of your body and savoring that, right? So just like we talk about lingering, savoring is just as important, right? It's lingering in that positive sensation.
Yeah.
So lingering in that sense of felt sense of support. You could do it with your back against a wall and just feeling like it's holding my weight. It has me. Some people like to do it outside, hold baby and step in grass and say Mother Nature has got us,
Hmm.
right? So that feeling that support, I think, can be helpful. Orienting, which again, it sounds cheesy, but when you slow it down, we're not telling a story about the things we're noticing in the space around us. We're simply becoming aware of them.
Hmm.
So the way I like to do that is, if you're not holding baby, bringing hands up behind the head, if that's feasible in your body. If not, you can just rest them at your sides. And I kind of, interlace my fingers or rest them at the back of the head and stick my elbows out. And then gently, as slowly as possible, turning my head to the left and just seeing what I notice in the space around me. Yeah, you can do it with me.
Hmm.
If it feels good, maybe sighing or exhaling. There's no right or wrong. And then if you want, you can stay, or you can slowly bring your gaze back to center. You can hang out there, or even continue to the right. And again, we're just noticing what we see in our space, maybe naming it in detail, internally or externally. And then coming back to center whenever you feel ready. And feeling free to maybe try that extended exhale if it feels good, just letting it be one moment longer. I'll sometimes invite some gentle cat like stretching here, maybe inhaling arms up and exhaling with a sigh if it feels good. Arms can come down and shake and roll it out. But just that 30 seconds to a minute of letting your system orient, what it's doing is saying, hey, I am aware of what's around me. And right now, baby and I are physically safe.
Mm-hmm. I love that.
Because, we're running around a lot as parents, and that can continue that cycle of feeling on edge.
Yeah. Yeah. And that our nervous system is always scanning safety, danger, safety, danger. And so if
Yes.
we can remind our brain and our body, I am safe, baby is safe,
Mhm.
I don't think you can do it enough.
Yeah, and if that doesn't feel true, because I do hear that from a lot of people, if they've been through a lot medically, them and their child, they'll say it doesn't feel true. I can't say that.
Mm,
Then find something that does feel true to you. So maybe it's not, I am safe for sure. It's in this moment, I am safe, or I am as safe as is possible, or I am
yeah.
physically safe.
Yeah. I like that adjustment there. So, how can someone tell, for those that are listening, if they do need more support? So, maybe they've been through the stressful birth experience or maybe a NICU experience and they're not sure, um, like, do I need help for this? Am I okay? How can someone tell, yes, I need support? And how do they begin that conversation with a provider?
Yeah. So I think some common experiences, maybe that moms who've had a child in the NICU or do actively go through, and they might not flag as like, hey, this is something where I could use support. So feeling like we talked about, feeling nervous at your own medical appointments, but also at pediatric appointments,
Mm-hmm.
constantly wanting to call the nurse or the doctor to double check on things. Checking if baby's breathing again and again and again. Like just you keep opening the monitor, or it like lives in your hand. Um, Feeling disconnected or detached from birth photos, or like you can't stop looking at the birth photo.
Okay.
Um, Having a large and reasonable emotional response to hearing hospital sounds. A lot of moms will not realize, and then they get pregnant again, and it's
Yeah.
pure panic of, oh my
Yeah.
gosh, everything that I kind of forgot happened to me is now coming in
Yes.
like 8 to 9 months, and help. So that moment can be another flag. Feeling much more irritable than is usual, guilt that doesn't quite make sense, not wanting to talk about the birth or struggling to talk about anything else.
Mm-hmm. Mm-hmm.
Like postpartum PTSD is already high, right? And it's higher. Parents with a child in the NICU are at higher risk for
Yes.
this. So I
Yes.
think just there is no shame around getting support,
Mm-hmm.
even whether or not you meet a PTSD
Right. You
diagnosis.
don't have
This
to
is a really
qualify
hard
for
thing.
help. You
Exactly. We don't
still
need to compare suffering.
yeah.
Trauma is trauma. If someone else needs help, I'm sure you would want them to have it. And the same goes for us, right? We have to practice what we preach. We're modeling it for our kids too. So if we want them to feel comfortable getting support, us getting support is a really good way to teach that.
Yeah. And when we talk about those symptoms, it's not a checklist, right? Like you don't have to have all of those or meet all
Yes.
of those. And really just, for the moms that are listening to trust your instincts and trust your body. And if you're feeling like something ain't right, then you deserve to reach out for support for sure.
Yes. Yeah. Mm-hmm. Yeah,
With
completely agree.
You know, I always like to recommend Postpartum Support International. So they have a provider directory where you can find providers in your state that are um, certified or trained in perinatal mental health. And then also they have a lot of really great free groups
Mhm.
that are all online, virtual. You do have to register in advance, but they have some that are specific for birth trauma and some that are specific for PTSD. Are
Yeah,
there any
that's
other
wonderful. I've definitely
resources?
recommended them to
Yeah,
clients before.
yeah. Any other resources that I know on the top of your head that you
Yeah,
think
I
would
think that one is excellent. I agree with finding a therapist who's experienced in working with postpartum moms.
yeah,
Uh, One who's experienced in medical trauma, I think, may also be a good choice when you're looking for a provider.
yes.
Uh, and something I just want to name that I'm not sure I did before is just coming back to that attachment piece, just because I hear it so much.
Mm-hmm.
I want moms to know that like attachment isn't built in this single golden moment or hour. You
Yeah.
know, it's thousands of small moments of responsiveness over time.
Yes, such a huge reminder. I hear similar of like those moments are stripped away, which
Yes.
um, are valid, right? And I want to hold space for that. And I want to remind you that, and I always do this like gesture because I'm like that again and again, repetition of you holding baby and looking them in the eyes and responding to their needs and changing their diapers again and again and again and again
Hmm.
is what builds that healthy attachment. So I love that reminder that it's not built in a moment, it's not built in that golden hour.
Yeah. Yeah.
Yeah. Well, I just really want to thank you so much, not just for this conversation, but for the work that you do. I really love how you incorporate your work to honor the body and the nervous system and that inner experience, because I think that is where birth trauma lives. And so thank you for the work that you do and the
Yeah.
support that
Thank you
you're
so
giving mom.
much.
Yeah, it
Yeah,
makes
I'm
me
really
feel
passionate about it. Clearly, I know what it's like, and uh, I think that it is a gap as therapists in our care, like really knowing how to support and respond to clients who've experienced something like this.
yes, I agree. So where can folks find out more about you, your work, and your offerings?
Yeah. So a couple spots. I have Healing Hearts Wellness is my somatic therapy group. So it's all somatic and holistic therapists, and we also have yoga therapists. So what that means is from a traditional therapy standpoint, we can see people in our Exton office, our Philly office, or across the states of PA, Florida, and Delaware. Um, but virtually for yoga therapy, we can see people anywhere. So
Oh, cool.
that really opens things up for mamas or families who are interested in yoga therapy for support. And then if you're a therapist, you can find me on Wander Home. The website is in the works, but
Okay.
the Instagram is wanderhome.tlc. And
Okay.
it's just my continuing education therapy home and community for whether you're a wellness provider or a therapist and you just want somewhere to be in community with others, learn how to bring in ancestral, spiritual practice, cultural practices that are somatic in an ethical, effective way.
Okay. I love that. And we'll be sure to include that in the show notes as well. So thank you again for joining us. I know that your story, but also the wisdom that you hold is so healing and helpful and hopefully hopeful for so many that are listening. So thank you so much. I appreciate
Yeah.
it.
Thank you so much for having me. I'm very happy to share my story, and I do hope it helps other mamas who maybe felt alone in their birth journey to know that, there is hope there are paths to healing, and it's not just one, and you're not alone in it.
Yes, absolutely. Well, to our listeners, thank you so much for listening. If this episode resonated with you or sparked something in you and your experience, I hope that you felt seen and supported. And please share this episode with another mom who might need it too. And again, we just always want to remind you you don't have to walk through this alone. You deserve support. That's it for us today. Thanks for listening to Omaha Mom Talks, and we'll see you next time. Thanks.